looking for an alternative to progression-free survival, and there's a good reason why you might want one of those. What we're talking about is complete response rate at 30 months as a surrogate for progression-free survival for first-line follicular lymphoma patients. And who I'm talking to is follicular lymphoma analyst of surrogacy hypothesis, or FLASH, and the director of cancer statistics at Mayo Clinic. What a great name, by the way, FLASH. I think that's a great study name. Now, this is a analysis by the FLASH people, right?
That's correct.
Now, what is it you're looking for? Why do we need something that's different than progression-free survival, which seems like, isn't that what everybody wants?
Well, of course we do want long progression-free survival. However, in first-line follicular lymphoma, treatments have got quite effective. And in fact, median progression-free survival is now 7 years. That's great for patients. It makes it hard to study new treatments.
Studies, yeah.
And we don't want to wait 7 years and then get the data and have a 10-year study.
Right.
So what we really need is an endpoint that we can assess more quickly, and that's what we were looking for here, is something that we could assess more quickly than PFS, but would provide good, accurate prediction for the long-term endpoint.
So what was the process in your mind in terms of, I know where you've ended up with the study, but what were you considering before you ended up with what we're talking about here?
Sure. So we knew we needed an endpoint more quickly. Why 30 months? Well, standard treatment in this disease is 6 months of induction therapy and 24 months of maintenance therapy. So 30 months is the time at which standard therapy is completed. If we looked more quickly than that, people would still be getting treatment, and we'd wonder if our results would be reliable. If we went a lot farther than that, we're starting to get to a time point where we're not really saving any time.
Right.
Plus, we've looked at individual studies and showed that patients who have a long-term, durable, complete response do better, have longer progression-free survival than patients that don't. So based on these factors and the input of the FLASH group, which is an international collaboration of follicular lymphoma experts as well as statisticians who know how to do surrogate endpoint assessment, we thought that 30 months would be the most promising time to look for this surrogate for the long-term endpoint.
So what did you find?
So what we did was we conducted a meta-analysis of trials conducted throughout the United States and Europe. We got the individual patient data, 3,800 patients, and we looked at, does the difference between a treatment arm and a control arm on the short-term endpoint, 30-month CR, predict the difference between treatments in the long-term endpoint, progression-free survival? And in fact, it did. There was very high concordance, very accurate predictions that if we looked at, does a treatment work on the short-term endpoint, 30-month CR, it gave very accurate predictions for what the long-term progression-free survival difference would be. So we could conclude that we could look in the context of a trial at the difference between two treatments at this early time point and be very confident that this is going to predict what the long-term outcome will be.
So would you be confident at this point to go to the folks at Mayo and say, let's try a study with this as the endpoint?
So in fact, we have submitted this data both to the US FDA as well as the European regulatory agencies, and we're hoping to formally get regulatory approval that this is an appropriate endpoint for first-line follicular lymphoma studies. Until that happens, the academics and the pharma will, of course, be nervous to use this. They want something that's been blessed by regulatory agencies. Yeah. So that's our plan. But in fact, we've met with them multiple times, the regulatory agencies, and they've been involved in creating our analysis plan, creating our pre-specified decision rules, our pre-specified statistical methods. So we followed everything to the letter that we had said we were going to do. So we are very confident. Of course, you can never predict a regulatory agency, but we feel that we did this very rigorously and with the express goal of having an endpoint that would meet the regulatory approval standards.
Well, I think this is exciting. I think this is something that could be used by a variety of investigators around the world if we can get everybody to agree.
Absolutely. So one of the critical elements here is this FLASH group. I'm glad you like the name. This FLASH group really is the thought leaders in follicular lymphoma. And this took 4 years in multiple meetings in nice exotic locations like Amsterdam and Bologna. But we pulled this group together We were independent academic group. We did have funding from Celgene, we had funding from Roche Genentech, but all the data from these groups went directly to us at Mayo Clinic. The drug companies have no access to the data, and we have the right to do the analyses we want and publish the results we want. So it really was academically driven, and we feel with that buy-in that we've had, as well as meeting with the regulators throughout this process, we're very hopeful that this will be something that can be embraced by the follicular lymphoma community.
Do you have any idea how long this process is going to take?
Well, we are in the middle of it. We've actually already submitted the data to both the FDA and the European authorities. So we're hopeful maybe within, say, 6 months to a year, we could be ready for this and have it accepted as a new standard.
So by the time the ASH meeting rolls around in December, you might have some optimistic news for everybody.
I hope so. No promises, but yes, we will do our best. We do feel important need to get this out there.
Well, this is a very interesting topic, and we have a variety of issues that we've been addressing here at ASCO. Please go online or to ASH Clinical News and read or watch more about it. I'm Rick McGuire in Chicago.